We await this move from the FDA. We wanted to know more about what this means, a potential booster shot for the immunocompromised. But then, of course, the question is, will this soon be possible for everyone else? I asked Dr. Anthony Fauci about that late today. Dr. Fauci, thanks for joining us, obviously, on a major night of news involving the virus.
Thank you very much, David. It's good to be with you.
First, I wanted to get right to this FDA decision on a third shot, a booster shot for the immune-compromised. I just want to make sure I understand this. This is mainly for vaccinated Americans who really didn't get a good response to the vaccine to begin with?
That is correct. This is not about the durability of a good response to keep it up. These are for people who almost certainly did not get an adequate response to properly protect them in the first place, which is understandable, because their immune system is compromised. And when you have a compromised immune system, you're not going to get the type of response that most of the normal general population. So it really is to get them up to where they should have been in the first place.
Dr. Fauci, obviously people at home are going to wonder, is everyone else next? You have said yourself that no vaccine lasts forever. So how soon could we see a potential booster shot for everyone here? Could we be getting guidance on this in a matter of weeks?
Well, I don't know if I can give you a time frame, David, but the one thing I can tell you is that we are following in real time, literally on a weekly and monthly basis, but definitely a weekly basis, where we look at the data from a number of cohorts of people who've been vaccinated, and we follow what the efficacy of the vaccine is, for example, against symptomatic disease. And in general, you know it's going to start tapering down. The rate at which we're not clear right now, but we're following it so closely, and we're simultaneously preparing to be able to give people that additional dose, which we refer to as a booster.
In the meantime, it would seem the Israelis, though, are ahead of us on this. Just today, approving booster shots for 50 and older starting next week, 40 and older expected a short time after that. So what are they seeing in the numbers that we're not?
What they're seeing in their population, David, is that when they go down over several months, they do pretty well, and then they have what looks like a pretty sharp drop in the efficacy. What holds up well, which is good news, is that they still get good protection against severe disease leading to hospitalization and death. But the protection against symptomatic infection and early infection has gone down considerably.
It's interesting you point out what you think they're seeing right now. So let me ask you about this new Mayo Clinic study just out tonight. It needs to be peer reviewed, but it does look into whether these vaccines are wearing off over time here in the U.S. And as you know, it suggests that the Pfizer vaccine, after 6 months, really begins to lose its punch, less than 50% effective after 6 months. I know more study is needed, but does this concern you?
Well, it does, and that's why, David, we're watching it very, very carefully and putting all of the data together on multiple cohorts. We look at every study. I mean, that study, as you mentioned, is a preliminary study. We're going to examine those data very carefully. Again, as we're doing that, we're preparing to be able to give people the booster if they need.
Dr. Fauci, you know, I always ask about the children here. We've reported hospitalizations for children are at their highest levels in this pandemic we've seen in different parts of the country. Are you seeing any data that this Delta variant is more severe in children than previous variants?
Right now, we can't make a definitive statement about that, David. It's a great question that gets asked frequently. We are seeing a suggestion in adults from a couple of cohort studies, particularly from the UK, that it appears that hospitalizations in the adults are more, relatively speaking, than they were before, indicating that the disease might be more severe in the adults. If it is, there's no reason to believe that we might see that in children.
I know that you have said that children should wear masks as they head back to school this year. California, the first state to mandate vaccinations for teachers and staff. Do you think teachers across this country should be vaccinated?
My answer to that is clear, David. Yes. I really do believe we have a responsibility to the children. The children, particularly those who are not able to get vaccinated because of their age. We need to surround those children with all those people who are eligible to be vaccinated, should be vaccinated.
Dr. Fauci, thanks for joining me as always. I appreciate it.
Good to be with you, David. Thank you for having me.
Dr. Fauci also driving home the message again late today that the effort continues to get 93 million people in this country who are still eligible for their first vaccination to get the shot. He says that's the only way to slow down this Delta variant and, of course, to help prevent future mutations.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.